So this is what you'll see when a call is coming in. All you do is click accept and click LHS1. The moment that is done, you click on video, and there we have our patient. You see your screen here, and you have your video sources. There's an overhead video screen. Any which one that you connect, it does have a little bit of a lag time, so do not get button happy and hit it too many times. There's a foot of the camera screen, as you can see there, and then one that's directly connected to LifeBot, which is a kind of a profile view. I think the overhead view is one I kind of like the most for the global view of the patient. And then for audio, they should be able to hear you. Who do we have on the other line? Alright, so they have Connie over there. They have inputted a pretend patient for us so that we can go through the screens. The patient run record will show the patient's chief complaint. In this case, it is chest pain. And then we will have, back up a little bit. So the patient run record, make sure you get that button. The patient run record button gives you the chief complaint. The vital signs give you, of course, a set of vital signs which are seen right here. Pulse ox at 95%, pulse of 78, blood pressure 146/80. The other button is your 12-lead EKG, which if this was a real patient, we would have a full EKG set for you. Observations will have the medical history. They will include the medications, past medical history, allergies. They will have that all inputted for you. As you can see, this patient has Celebrex and metoprolol, asthma, and hypertension as its past medical history. They will have put in any treatment modalities, treatments that they have given. In this case, patient received nasal cannula, oxygen. And then, of course, the narrative, which will have the vital signs that were taken. You can actually put in notes into LifeBot. And if, for whatever reason, audio is failing, you can go to F8, which will bring up a chat log, and you'll be able to chat with them via text, I think. There we go. So that was F8 to toggle off and on, and you can, and they can send and receive text messages as well. So pretty self-explanatory. You will go back and forth with them. You can examine the patient, ask them to perform a gross neurologic examination. You can focus in on the patient by zooming in with the in button or out to get closer looks at the patient. And again, make sure that you document everything on the T-sheet. Once the call is done, they will disconnect and you'll be done your phone call. And that is the 5-second orientation for LifeBot. You can always call me if you have any questions, and we will be able to address things real time as well. Thank you.